I didn't even know dental assistants existed till my sister-in-law, who's a hygienist. Whenever dentistry had started back in the 1800s, we were dental nurses. And I love that title. I really want to bring that back. Doesn't matter how the dentist or the teachers teach. What matters is, did you get the same end result? Some assistants are not open to taking feedback and they always find that they're being criticized.
So, good afternoon to the Wealthy Dentist podcast family. I want to bring to your attention a young lady who has been in the dental space for quite some time, and she's going to share with you some of the work that she's done in assisting other assistants like herself through the process of helping dental offices across the country. And her name is Harmeet Gill. And I'd like to thank you so much, Harmeet, for taking time to join us this afternoon. How are you doing?
I'm doing great. Thank you, Ward, for having me on board. I really am looking forward to this.
Awesome, awesome. I'm glad to hear that. So tell us what got you interested in working in the dental field. Uh, why are you what why did you choose the dental industry?
Well, it all started. I am a graduate. I graduated through business
Hmm.
admin and specialized in HR. And my whole thing was to go into HR and restaurant business. But
Oh,
when you realize that that's a lot of work,
yeah,
wasn't ready.
right.
I've always would have been interested in the sciences and human aspect.
Okay.
And with my background and education background, I found that everybody was always striving to become doctors. And I didn't even know dental assistants existed till my sister-in-law, who's a hygienist, had introduced me to that profession by shadowing one of the dentists and their assistants. And when I saw what the assistant had to do alongside with the dentist. It's a lot of work and a lot of what do you call it? You need those particular personalities and characteristics in order to be engaged with patients and the team. Now, she had recommended me to try it out. So, what I did is I went back to school, I upgraded my sciences
Hmm.
and my math and English because I had already graduated 15 years before I made the decision
Okay.
of becoming a dental assistant. So education one changed.
Okay.
Two, there were not enough dental assistants because there was a high demand for them. Three, I could have went into dental school, became a dentist, and then specialized as a surgeon. Well, then I have two children. So I had to make an executive decision based on my family dynamic. Now, do I take the time to go back to school full time for 10 years and miss out on the growth of my children, or do I take a 10-month program and go to school with my kids and show them and they get to see me every day in the evenings? Because I lived in a city that did not have a dental program at the university, and that's at the University of Alberta, and I stay in Calgary.
Hmm.
So just trying to brainstorm, lay out my, obstacles, challenges, what's possible, what is ideal. I chose dental assisting in that case. So when I was in school, dental assisting school with SATE, I met amazing instructors. How much knowledge a dental assistant had to carry with her and learn in order to perform at her best ability alongside the dentist, and also understand what the hygienist's career entails and what they do as well, and understand why they do what they do. And watching my instructors go through what they did, it inspired me and gave me a lot of, it was a really good confirmation that the field that I picked was the best field because technically back in, whenever dentistry had started back in the 1800s, we were dental nurses. And I love that title. I really want to bring that back.
Okay.
right? Because as much as our colleagues and our dentists support the idea of dental assistants, the outside world that does not know what dentistry really entails, as in professions and our roles, they think dental assistants are hygienists. So there is a huge differentiation there. So that's what I want to ensure that our patients are fully aware what our roles are. Sometimes I feel that patients get dental assistants and dentists mixed up. So when they see a new face as a dental assistant, they already are apprehensive and they want to see an old face. And I also want to break that anxiety from the patient that they need to, it's nice to trust us. In return, as assistants, we need to also provide that we need to gain that trust with our patients, even if we're a new member to the team, create that space for the patient to understand who we are and our colleagues. Um, I've been assisting for 12 years. In the 12 years, I've worked, and within the 2 years of my profession, I had gained so many, I'm a learner. I have my ortho. I've got my IV sedation. So in the span of 12 years, I have my ortho IV sedation with the help of amazing dentists that are about education growth for their team.
Mhm.
Okay. With all that, I also had the opportunity to teach at a college for the dental assisting program for 4 years. In that time frame as well, in the 12 years, I had the opportunity to travel up to Nunavut, the Arctic Circle, and provide my services to the locals that are limited to the resources, as in all aspect of life. Dentistry is one of them. Engaging with other communities and understanding their lifestyle and their culture and beliefs also allowed me to understand what the human mind is about, understanding others' perspectives, not just mine. And I find dentistry is the biggest obstacle that a patient faces where they're very afraid of us.
Mm.
They think, when they think about drilling a tooth, they think about an instruction, mechanical, that commercial drill.
Yeah.
The reason why I've learned over time, speaking to patients, the reason why they have that fear is because they can't see what's going on and they don't want to be awake. Because most of the medical procedures, they're sedated. That is why when I want to give back, and I knew I had it in me to go into dentistry, one, it was ideal for my family dynamic. Two, why I went into teaching is because I can get the new generation that is interested in the dental field to understand how the human mind works. I've taught in the 4 year span of teaching, oh gosh, a handful of students, and they're all doing very well. Maybe the oddball just couldn't make it through it because it wasn't their thing. And that's not to put them down. It's just that maybe this is not the ideal profession, but get through it. You can use these skills elsewhere. Mentoring, that's where the mentoring came in. I have been a lead in multiple clinics. And the current clinic I'm at, I chose to step down for a bit and just assist and understand the team dynamic and the patient dynamic.
Mm.
I mentored. Why I provide free services is because it's a skill that you cannot, what is it? It's like a hidden skill. Does that, you're born with the talent, you're born with the skill, but then there's tools that you can learn by taking courses and so forth. And it takes a while to understand the dynamics of how we can make a difference in our dental field. And I notice that a lot of dentists are so engaged in their profession and communities. I don't see as many assistants doing that. So why I chose RDA, Registered Dental Assistant, is that I want to put it out there that, come on, guys, we should be proud of our profession. Don't there's a handful that were just assistants. If we knew something, we would have been a dentist. I go, you have no idea how much we actually know. We know a lot.
Yeah.
We just have a lot on our plate that we sometimes have to go into our mind file and pull it out. There's a lot that we actually do and play a huge role in the dental field. So I want to change the culture of degrading dental assistants and teach them that we have a lot that we can give back. We should be very proud with our profession. And the only way we can see the changes if we're proud in what we do, we will have that support system. If we're not as engaged and we're like, oh, it's just dental assisting, you're not going to feel that empowerment.
Mhm.
And that's just not based in our profession. It's also how we apply it in our personal life.
Mhm.
We all work together at the end of the day.
Mhm. Mhm.
Yeah, we don't get paid as well as hygienists, but we do a lot more than hygienists do. So that's another thing is I want to able to make a difference.
Mm. Wow. That was a lot. That was a lot to unpack there. Wow. Yes, I do appreciate you being bringing candor to this conversation and letting us know where the dentist assistants stand. Uh, and you did mention that hygienists are much different than assistants, and that you have a lot stored in your mind file. Can you give us a little bit of what the day of a hygiene, no, I'm sorry, of a dental assistant is? What does a day look like? And what are some of the, um, I see some of the roadblocks you guys run into in the process of your day or week or however you want to present it?
All right. How it looks as our schedule, daily, biweekly, weekly. Daily, what we do is we first, before the next day or two, for my role, I'll speak on my role, and then that will give you a general idea what everybody else's looks like.
Okay.
Okay. I will do an audit. Audit basically, I check the patients the next day or two. Each patient, what's outstanding, if they've been booked for hygiene or not. Okay. That's one. Medical concerns, if there's any flags. All right. So we go through that. We write it on a schedule. We print out the day sheet. We write everything up. The day of, half an hour or 15 minutes before the patient comes in, we would go over what our day would look like, what each patient's concerns are, what's outstanding, how come the hygiene's not booked in, what could be preventing them from coming back. Just a few little obstacles. So basically coming up with a strategy, how we could help and guide our patients. Okay. The rooms are all set up the day before just to reduce the anxiety and to prevent rushing through the day and forgetting an instrument or material that needs to be, that is needed during a procedure. So the rooms are prepared the day before, the audit is done the day before, the audit is, we have a staff meeting in regards to the audit the day of.
Mm.
Okay. We are constantly making sure we seat the patient, we get the patient to sign a consent, we prep the patient, we apply the topical gel. Once the topical gel is placed, we get the dentist, they do their local anesthetic, they leave, we follow up with the patient. Are you frozen? If the dentist needs to use a rubber dam, which is an isolation, we do a little bit of a test to make sure their lip and tooth is frozen. Or they use a dry shield, which is an isolite, which is great. It has suctioning in it. So we got to make sure the little wedges and instruments and material, the micro brushes are all there. Okay, floss, you name it, the little 2x2s and cotton rolls. We got to have it ready. We sit down, we're like, it's like Ben Johnson, we're ready to run. And we hear that on your mark, is set, go. So as soon as that dentist picks up the high speed, we're ready with the suction. We get right in there. And it's like sometimes we feel like we need to be Inspector Gadgets because We have three, four different instruments in our hands, and we only have two hands. And the best thing is that when you work with a dentist that sees that and they can have actually a good sense of humor, it makes the job so much more easier and fun.
Mm,
And the patient can feel that energy and they love it.
mm,
There's no such thing as poker face. If you have a poker face and you're closed-minded and you're huffing and puffing, it makes it so hard on the patient, which makes it hard on the assistant and the dentist. So
mm,
the energy, mindfulness is very, very important,
mm.
right? So then once the procedure is done, okay, that's a good, say, depending what we're doing. It ranges from 20 minutes to a half an hour to an hour and a half, depending on the procedure. So there's restorative fillings, crown and bridges, dentures, extractions, implant placement, root canals. Those are a lot. There's about seven, eight ortho. The one dentist I work with, she works with TMJ, neuromuscular. We're looking at like maybe nine, 10 different skills in one a day.
Oh, wow.
Okay. In that, we're flipping the room, we're cleaning the room.
Yeah.
Okay. We go to the sterilization, we process the instruments.
Wow.
If we're lucky to have a team that's willing to help each other, it makes it easier. We
Mm.
barely get a break. We
Oh,
have to push for a break.
mm.
So that's just not us assistants. Sometimes the dentist doesn't have an opportunity to have a break. So we barely get a break. So we're constantly go, 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 go. And it's the best way to burn calories. That's all I gotta say. Because you're talking, you're going back and forth, and you're breaking a sweat, and patients don't know that.
Right.
And we are trying to stay grounded
Yeah.
through every possible situation that might arise.
Yeah.
Because some patients love the dentist, okay, which is great, makes our job easy. Some have extremely high anxiety.
Yeah.
So we're watching their pulse, we're watching their body. So we're just not only in their mouth. Now, I know the dentists have these loops, they got a tunnel vision. So as assistants, we don't have the loops, right? And we're watching the dentist, we're watching the handpiece, we're watching the patient's body. We're constantly, scanning the patient and the dentist at the same time. So we're like babysitters, monitors, guiders, caretakers. Okay, we're playing a lot of roles. One, we're being very no, like when the dentist has tunnel vision loops, and their handpiece, they have to retract one side of the mouth. We have to do the cheek or the tongue. If we're retracting the tongue, they retract the cheek or the other way around. When they have a tunnel vision, sometimes it's really hard for them to know because they're very focused on that tooth that we're watching that retraction on their end and that handpiece. So imagine that you're watching two people with handful of instruments, and you also as an assistant, well, one person with handful of instruments, and as us assistants, we also have our hands ready with instruments.
Yeah.
So we are constantly on the multitasking. So we have a lot. And
Mm.
I want to bring this out on all the dental assistants that, guys, even though we have a 10-month program or 6-month, 8-month, and I know the Canadian dental assisting program is different than the American dental assisting program because one of them had actually reached out to me and I'm learning this. And I'm like, oh, I thought you guys had a 10 months. She's like, no, we only have 4 months. So the amount of information we are learning compared to what is being taught down south, Canada and US, it's a huge difference because she's like, we don't get enough clinical skills or mentoring down south, and our dentists expect us to know everything.
Mm.
Now, that's where the lack of communication happens between the two organizations, colleges,
Interesting.
right?
Yeah.
So I chose this field because I want to make a difference. I want those that choose this profession to feel very confident and understand why they're choosing this profession and take it to another level. This is
Awesome.
not just work, it's actually a profession.
Yes. Yes.
That too, I have an amazing support system from dentists and my colleagues and hygienists that, yeah, they do see this and they're like, yeah, do it. There's not one person out there that is willing to be the voice or the elephant in the room.
Hmm.
I'm tiny, but my voice is big,
That's good.
right? But I want, and you know what? No matter what you do in life, you need to take it with pride
Absolutely.
and authenticity. So that's why I chose this because I find it's like the most difficult field for anybody to even embrace if they're not connected and they're trying to figure it out. There's so many ways that we can enjoy what we do and apply it to our even our personal life and vice versa.
Wow. So that was great. It's obvious that you are passionate about what you do. Not only what you do, but what you try to give others. And what you've said so far has been quite an eye opener. Um, I mean, like planning and the day before, then breaking a whole set down to start another procedure in another room or wherever you are at that particular point. It's like a constant, like you're constantly moving. And I can see how that can be overwhelming in some cases when, you're doing all this
Yeah.
work, hardly ever get a chance to just take a break. So,
We're lucky to get a break, but there's days when we don't have relief.
yeah.
And this is where it's nice where we're allowed to bring our caffeine, protein shakes, and
Hmm.
place it in a particular bay where
Hmm.
we can just go to and just kind of take a kind of breathe in, breathe out, relax, and sip, and then woof, go back. So it's like Speedy Gonzales or, Roadrunner.
Right. Oh, interesting.
Yeah.
So now, as an dental assistant, I mean, like, do you have to be familiar with a lot of, I mean, I know you talked about the tools. How about electronics? Do you
Yeah.
have, how familiar, and which ones do you prefer
So
over?
I really, really prefer ClearDent.
Okay.
So the different types of dental software that there are is ClearDent, Dentrix, Gold Management, Patterson, People Software, Eagle Software, Open Dental is one. Oh, there's a handful, and I've worked with all of them.
Okay.
Right. So I work at a main clinic that uses, oh yeah, and there's power practice. So I work at one clinic that uses power practice. It's like ancient, but to understand it at first was really difficult. Now it's like I can do it in my sleep. It's like a reflex. Boo, boo, boo. I can do that with ClearDent. Doo, 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 doo. And I can do that with a couple other softwares too. Um, we need to know the IT side of things. We also need to know about equipment repair. We also need to know about the procedures.
Mm.
And equipment repair has to do with the dental chair, the dental sections, the dental handpieces, the steri equipment, the x-ray equipment, the back equipment. And imagine how many rep in
Yes.
touch with in order to help us tackle these challenges.
Mhm.
We need to know and familiarize ourselves with the materials that are being used. Now, this is where I kind of have a little bit of a disagreement with the hygienist is that they do the same thing over and over again. If you were to put a hygienist in our position, they would not know what to do. But if you were to put us in the hygienist position, we already are familiar with their materials and equipment because that's what we need to do, right? And like need to know, sorry. So if he was like Hermit, and I'm not authorized or licensed, but let's just say if he wanted to play a game, I would know exactly what I had to do as a,
Hygienist.
if I was to be an hygienist coming from my assistant position, I already know what they do. But if you were to put a hygienist into our position, they wouldn't even know what materials to put together. Do you see what I mean? The skill is higher, but we don't get paid as much. So that's where I am kind of curious how that is and why don't we all get paid the same?
Yeah.
I'm
Yeah.
not saying demote somebody. I'm saying, hey, why don't we bring it up here? Yes, scale wise, 1 year, 2 year, then you base it on that.
Do you find yourself actually, you know, having a conversation with the dentist about what they're actually doing with the patient and probably helping them along the way? You might see something that they should be doing that they're not. Do you ever have those kind of situations?
Yeah, I have. When I was up in the Arctic region assisting, there was a dentist I would question. He didn't like it because he was in the field for 30 some years. So it all depends who you're saying it. And yeah, he really didn't like me, but he had to put up with me because I was the only assistant there. And I was actually vouching for the patients in
Mm,
certain cases, right? But I've and here I don't think I ever ran into a situation where I disagreed, but I was more curious.
mm,
Hey, I know one dentist would do it this way. Can you explain why you do it that way? I wanna understand it a little bit more. It's
mm,
interesting how everybody can do different things but have the same end result. Why would you use bond and not etch, and would they use etch and bond, like certain materials, because there's one way that we're taught in school, and
mm,
there's a one way that we teach in school, and then you see that across the board, about 85% of them uses the same technique, and then you get this odd one that throws a freestyle, and you're like, oh, that one's new. Explain.
mhm, mhm. So do you
And
find,
that's one,
go ahead, I'm
yeah,
sorry.
sorry, go ahead.
No, no, go.
And that's where with my former students, I've taught them, it doesn't matter how you eat your apple and oranges, but at the end, it tastes the same. Doesn't matter how the dentist or the teachers teach. What matters is, did you get the same end result?
Mhm.
I
Okay.
go, if we had to do things in a very operative way, and it's like book, yeah, I'm sorry, we're human. We're going to be talented. We're going to be creative.
That's
Is
right.
there's never a wrong way, but as long as you get the end result.
Yeah. Yeah. So are you finding yourself, do you like when you're mentoring your group, do you find yourself role playing at all? When you teach, do you
Yeah.
find yourself role playing? And what are those, what is that like? Well, I mean, how do you create a role playing situation?
My role play would be more on interaction
Hmm. Yeah.
with patients and each other. That's it.
Yeah. Yeah.
But role playing, it was always a case when we are mimicking, mocking procedures.
Okay.
It's
Okay.
like, hey, watch and learn.
Hmm.
Okay. And then write down your questions and we can go over it.
Hmm.
Why would I do this? Why would the person do that? Curiosity. So that's how our role playing always has been is monkey see, monkey do, show and tell, right?
Hmm.
Let's get out of the bad habits.
Oh, yes. Yes. So in terms of when you're role playing, do you actually talk about the communication aspects, the body language of not only the patient but the
Yeah,
dentist as well? So
yeah,
like, how deep does that get?
very deep. Because everybody perceives it different. And once you're in the field, you're like, if you're that person that you're, oh, I'll just nip it in the butt, they're having an issue. It's not you, they're just having an issue themselves.
Mm,
So it takes a while for someone to reach that peak, right?
mm, mhm, mm,
Or you confront it in a nice, respectful manner. Just say, hey, like, is everything okay? You went, you know,
mm,
it's like, did I do something? I won't know till you let me know.
mhm.
So I don't make the same mistake. Oh, it's not you. It was just this. I'm like, okay, well, maybe we can be a little bit mindful in front of patients.
Yeah, yeah. And if you get some kickback on that or someone that's like want to back up on that kind of conversation or communication, I should say. I mean, then what? I mean, like, cause this could be a problem, you know? I mean, not being able to communicate and connect with the people that you work with every day. can
Hmm.
not being, you know, like having a somewhat of a free, open type of window to express yourself. If not at that particular point, because sometimes it's not necessary to have that conversation then, but afterwards. I mean, at what point do you guys actually have those kind of conversations? Is it before, or after work? How is that? Because I know that
Um,
you have to have
if
a conversation.
Yeah, okay, I'll give myself an example. When I face such circumstances, I will sit with it about 24 hours or till I'm confident to have a conversation with the person because at the same time, we have to understand where that person, you know, the disc personalities? Have you heard of disc
Yeah,
personalities?
yeah.
So that's where that plays a role is like, how am I going to, if I have to confront you or have a conversation with you, Ward, I have to understand what kind of personality you are.
Mm,
Based on that, I got to choose certain words and tone of voice. So I'm not offending you. So you don't feel like I'm attacking you. And then you can see like, oh, okay, I didn't know that was happening. I apologize. Right? We have so many different personalities in every possible environment of work environment that we're at. So just taking that moment, but once you know that person very well, it's like, hey man, what was going on? Then that friendly voice comes in because you don't know if that person sees you as their friend or just a colleague and call it a day. You don't know. Some people are not open.
mm,
It's just understanding the personality. So that there's a lot that we have to think about,
yeah.
right? And it's not just our profession, it's with everybody.
Yes, yes. So when you go in and let's just say you want to go to another office and you want to work at a different space, different place. What are some of the things that you look at when you go into an office? What hits you like, red flag or the green light? What makes those really happen for you when you just go in and you're just observing the space? You haven't spoke to anyone, but
Yeah.
you got an opportunity to tour the space. They didn't necessarily know you were coming.
Yeah. Yeah. And that has happened. That has happened. That has happened.
So share some of that
The
with us.
yeah, it's the energy, the
Mm,
mindset,
mm,
their performance.
mm,
You can see if they're are ignoring the patient or they're really engaged with the patient. You
mm.
can see if they actually complying to the regulation or they're not.
Oh,
You can see their workstation and you can take a look at the operatories. You can look at their steri bay.
mm.
Yeah.
Okay.
And their tone of voice. If they're shouting across the room in the hallway in front, hey, Julie, did you get that? I'm like, oh, there's patients here. Oh, did Paul come in for his appointment? Oh, confidentiality.
Mm.
So,
Wow. You don't think of you. I mean, you really don't think about those things, as an outsider.
yeah.
And like yeah, I believe a dentist told me a few I don't know, a few months ago, if you go into the front door of a dental place, it's going to tell you what's happening in
Yeah,
the
that's right. Exactly.
I mean, what's happening in the front is going to, I mean, you're going to know what's going on in the back. Oh,
That's right.
boy. It's so telling. It's almost like going to, and he compared it to like a restaurant, because if you really want to know how clean a restaurant is, you go in the back. It's the opposite for dentists.
Oh, well, yeah. Well, you can smell.
Yeah, all the
It's the
assistants. Yeah.
smell, that distinct odor. You can smell it. Because I used to work in a restaurant before I even graduated from school. And it's the smell.
Yeah. And that same goes applies
Yeah.
for
And the ceiling
uh
and everything. It tells you how the clinic is running. What is the management doing about it?
Mm, mm. It's almost, I mean, so you, I mean, with what you've expressed to me already, particularly earlier, doing all of the planning, having all of the tools set up, prepping the day before, prepping after a procedure is done, breaking it down, sterilization, all of this stuff. And it's like, you got to do this again. I mean, that that just seems to be I mean, quite a bit of work, in my opinion. I don't know. Maybe,
It's like running a household. When you go for dinner,
yeah,
you sense the energy, you see the food, the plates,
yeah,
the presentation.
yeah,
But if you are the host,
right,
you want to make sure whoever comes in those doors is welcome
right,
and is comfortable,
exactly.
or you don't care, one
Yeah.
or the other.
Yeah, I guess my point was in mentioning this, I mean, like it almost seemed like because you have all of this planning, but in your head,
Yeah,
all of this
yeah,
experience, that I mean, you could very easily move into a management director
yes,
type of
yeah.
position.
That's if they are willing to take you on board and willing to be open to some ideas as well. So it's not, I'm not saying all clinics are closed-minded. It's just that if the opportunity is there and they're willing to be open with some ideas, but then also I myself got to be open to their way of doing. It's like a new family member coming into the family. That's why I keep relating family and work
Absolutely.
because no matter what we do in our household, we're always prepared. We're doing this, they're doing that, laundry, dishes, cleaning, cooking, whatever, right? We're also doing the same amount of work when we're at work. So yeah, easily can get into a management position.
Yeah, yeah. I mean, that just sounds so like the obvious transition if you wanted to do.
Yeah.
It would be something that, I would think that a dental assistant, that you giving me all of this information would be, I mean, it'd
Yeah.
be like the thing to do. I mean, if they wanted to kind of make more money and,
Yeah.
experience other ideas and see other offices, go around the different, whatever region that they're working in, if they have several offices, it just seems like, that's something that you could
Yeah.
easily.
I honestly would love to see a college in the States. I want to know what they're teaching, what their curriculum is like
Hmm,
compared to the Canadian curriculum for dental assisting.
hmm.
But the national board exam is identical to each other.
Oh, really?
Yeah. So it's the MDA book is published in the States.
Hmm.
Okay. And we have a 6 to 10 month program, or 2 years, depending what college in Canada. But like how I was saying earlier, that one of the girls down south in the States reached out to me. Oh, I only have 4 months. What are you guys learning in 4 months? I'm kind of curious,
Yeah. Yeah, well, that's an
right?
excellent question. That's a question that needs to be, I guess,
Yeah.
get some answers.
It'll come. It'll come to me.
Mhm. So tell me, what have we missed? What more would you like to speak about? We've talked about quite a bit. I've learned quite a bit. Thank you for that. Um,
You're welcome.
what did we miss? Is there anything? I'm sure there's something that you could uh, share with us.
Um, who's open to learning and taking feedback? That's another one. Some
Mm,
assistants are not open to taking feedback and they always find that they're being criticized.
okay.
Now, how you perceive feedback is something that I strongly feel that is something that an area that an individual, it's good for them to work on. Now, the person providing the feedback also probably an area where they could figure out their personality type. That's where the DISC personality comes in, right? But when you're receiving feedback from your colleague, it's just nice to be open to it. Maybe there'll be a few words in that conversation that might resonate to you or might give you that, oh, right? Also be open to asking questions to the dentist. They do have a lot of qualifications in order to make the calls. It's okay to say, well, why that? And I know I forget that sometimes. I'm guilty of it. Right now, I don't really ask, I observe. If you're not sure, observe. Maybe you need to watch it a few times, and then if you still don't understand, that's when the asking comes in, right? Certain things in our life we get impacted by, and we try not to take it to work with us, but we don't realize that it creeps up on us at times. So the way we can't be perfect all the time. We are perfect not being perfect.
That's right.
So open-mindedness is one, asking questions, requesting feedback allows a person to grow into a better, allows a person to grow overall for yourself.
Indeed. Agreed. Well, Harmeet, thank you. Harmeet, thank you so much for joining me today on the Wealthy Dentist podcast. I appreciate your candor again and your ability to show all of these pieces and parts that the dental assistants do, what they're up against. I'm sure a lot of us, like I didn't know none of this. So I have a different perspective now. I appreciate it.
Yeah. Thank you. And thank you so much, Ward, for having me on your podcast. I thank you. It definitely feels good to be back on board for sure. And I really appreciate the time you had provided me.
My pleasure. The Wealthy Dentist podcast is built on connections, opportunities, and meaningful conversations that help jumpstart careers and boost the ROI on your business. Is there a topic you're passionate about or someone in the dental community who should share their story with us? We want to hear from you. Email your suggestions to the Wealthy Dentist Podcast at gmail.com, and let's create content that informs, inspires, and uplifts the dental world. Your ideas could spark our next big conversation. Let's make it happen. I'm Ward Powell, your host at the Wealthy Dentist Podcast, thanking you for being a part of our journey.